Hey everyone, my name's Daniela Ovalle, and today I'll be presenting my family assessment. For this project, I interviewed the Valentine family, which consists of a mother, Danielle, and her two children, Jordan and Cody. I used the Freedman's Family Assessment Model, which is a framework used by nurses to assess families as social systems. It provides guidelines for family nurses who are interviewing a family. It focuses on how family structure, roles, relationships, and functions influence health, and it identifies family strengths and stressors. The model has 6 key components, which are identification data, developmental stage and history of family, environmental data, family structures such as roles, values, communication patterns, and power structures, family functions, and family stress and coping. So for my family, they identify as Caucasian and they live in Slidell, Louisiana. We have Danielle, who is a 50-year-old single mother. Her highest level of education is a bachelor's and she is the senior HR manager at Aaron's. We have Jordan, that is Danielle's 27-year-old daughter. She is single, lives at home with Danielle and Cody, but she is getting ready to get married next year and moving out soon. Her highest level of education is a master's, and she currently works as a speech pathologist. And then we have Cody, Danielle's 15-year-old son. He is a student at one of the local schools in the Slidell area. The family identifies itself as upper middle class. They have lived in their home for the last 10 years. Danielle is from New Orleans, and both Jordan and Cody are from Slidell. All right, so here's my genogram for my family. We're going to start off with Danielle's side of the family. Danielle's mom and dad, Harry and Susan. Harry passed away 10 years ago. He was the district sales manager for CBS, and he passed away shortly after being diagnosed with spinal meningitis. We have Susan, who was a homemaker, and she occasionally worked at the Catholic Church. She is 81 and is diagnosed with diabetes. Susan and Harry had Danielle and Aaron. Aaron is Danielle's younger sister. She is 48, currently does not have any medical diagnosis, and she is the senior IT for Blue Cross Blue Shield. We have Danielle, who is the senior HR manager. She was recently diagnosed with anemia and she had some internal bleeding issues earlier this year. Danielle married Dylan and they separated shortly after Cody was born. They had Jordan, who is 27, healthy, and she is a speech pathologist. We have Cody, who is 15, a high school student. Cody has Down syndrome and has been diagnosed with hypothyroidism. We don't know much of Dylan's history since Danielle does not have contact with him. She did say that when they were together, he was a smoker and he had been diagnosed with high blood pressure. Both of Dylan's parents are deceased, and Danielle did not know anything about their medical history. All right, so let's take a look at our eco map. This shows the Valentine's family's connections with their environment and support system. We can start off with the children's father. As you can see by the key, they have a tense relationship with their father. Jordan nor Cody really have a relationship with him. And when they do communicate, it's not on the best of terms. We have Cody's caretaker. The family has a strong relationship with Cody's caretaker. Danielle is often traveling for work, so his caretaker is usually with him, especially during like vacations or if Cody's on break. Usually the caretaker will stay with Cody majority of the time, and sometimes she'll stay overnight. We have Danielle's job. She has a very stressful job. She's in charge of over 9,000 employees, so her job is very demanding and can be stressful at times. We have the kids' education. Jordan holds a master's degree, so she has been very successful. Cody attends one of the high schools in the Slidell community, and they do a great job at helping him, especially with his disability. We have the Catholic Church. The family has a strong, meaningful relationship. That relationship is positive and stable. We have the Miracle League, which is it's like a team. It has a bunch of, it's for kids with disabilities. It's year round. They play baseball, basketball, kickball. I've personally have been to some of these games, and it's a wonderful thing that they do. Cody does usually attend one of the games once a week, so this is a very strong relationship. It gives them something to do. It gives Cody like a sense of purpose when he's out with other kids. For healthcare, everyone in the family has access to healthcare, and they all have health insurance. Danielle's job has definitely given them good health care, as well as they are in a good financial situation. So all strong ties there. And lastly, we have Celine's Women's Group. That is a group that Danielle is part of. She is one of the leaders in that group. And it's a way to give back to the community, and she loves it. So according to Duval's model, the family is in stage 6, the launching center. The firstborn through the youngest child are leaving home. We're accepting new family members. Children are becoming more independent while maintaining parental ties. And it says parents must adjust to independence. As we discussed earlier, Jordan is getting married, and she is soon leaving the house to move in with her fiance. With Cody, we kind of have to realize that because of his disability, there's going to be extended dependency and prolonged parenting responsibilities. Overall, the family displays good communication. Danielle and Jordan are both strong senders and receivers, kind of meaning that they communicate clearly and respond appropriately. Cody experiences some challenges as a receiver, but that's kind of expected given his developmental disability. Despite that, the family uses patience, repetition, and supportive communication styles to kind of help keep a good routine among them. The family's power structure is centered around Danielle, who holds legitimate authority as the head of the household. Jordan holds referent power, meaning she influences the family through respect and emotional support. Cody, having Down syndrome, he is nonverbal, and he contributes through tension management power. His presence and needs influence how the family organize routines and decisions. So next we have role structure. Danielle fulfills multiple formal and informal roles, including provider, housekeeper, child care provider, decision maker, and caretaker. Jordan also participates in caregiving and coordination roles. She helps support both her mother and her brother. Cody's formal role is learner and rule follower, and his informal role is recognition seeker. As we can see, Danielle carries the heaviest workload. So when I sat down with Danielle, she really emphasized that their main family values are equality, quality of life, good citizenship, respect. She really focused on how she just wants everyone to see Cody as an equal, like she doesn't want anyone to treat him less than. And also she acknowledged the tolerance for diversity, and then she also said that her family really values education and a strong worth ethic. Like I said before, all family members have access to health care and health insurance. They are seen by private physicians. They are fully vaccinated and they get dental checkups every 3 months. A little bit about their health history. Danielle, she had been having some internal bleeding issues this year. She's been kind of in and out of the hospital. She was recently diagnosed with anemia and has had to have several iron infusions. And luckily, they have all been covered by health insurance. For Cody's medical history, he has a genetic condition, Down syndrome, and he is also been diagnosed with hypothyroidism. Also, because of Cody's disability, usually everything has been covered with insurance, but Danielle did say that they ran into some issues with the agency that they use, so they're trying to get that all fixed up before next year. And then we have Jordan. She is healthy. She's 27. She doesn't have any current medical diagnosis so far. So next we have family stressors and coping. Some short-term stressors that the family is facing is some health concerns. Danielle has been having some fainting episodes for the past 6 months. Whenever she feels like she's getting dizzy, she tries to make sure someone's around and she lets someone know what's going on. Also, there's been some work concerns. Danielle oversees 9,000 employees, so she deals with conflict every day, and that is adding additional stress to her life. She did say the long-term stressor that the family faces is Cody's disability. So just making sure that Cody has a guardian after Danielle passes away that he's taken care of. She wants to make sure all the life insurance and savings, like make sure that they don't come across any issues with that. And for coping mechanisms, they really do rely on each other. They increase family time, and they also rely on the community and maintain relationships with other people who have children with disabilities. All right, so now we our ANANDA diagnosis. The diagnosis that I came up with was family coping ineffectiveness related to increased long-term caregiving demands for a child with developmental disability and uneven distribution of responsibilities among family members, as evidenced by difficulty planning for a child's long-term care and reports of limited time for self-care. So our goal is to improve coping and confidence in long-term planning. Our outcome is the family will verbalize understanding of available local support services for the disabled child in 1 month. Some interventions, evaluate how responsibilities are currently divided and how the disability affects daily life. Teach family about local resources and transition to adult programs in the community. Encourage open discussion among family members about workload, concerns, and expectations. Educate on stress reduction strategies and schedule breaks. And then provide referral to parent support groups for family of children with Down syndrome. Next, we have our risk for diagnosis. So this one I did risk for caregiver role strain related to increased long-term caregiving demands associated with child's Down syndrome and financial pressure associated with long-term planning. Our goal is caregiver will identify personal stressors and early signs of overload. Our outcome, caregiver will describe at least 2 strategies to maintain and improve well-being by the end of the month. Some interventions are to assess risk factors such as stress, workload, sleep, and support availability. Educate on information about community agencies and disability services. Encourage family members to identify tasks that can be shared, redistributed. Educate on stress management techniques and relaxation exercises. And then also assist family with drafting a long-term plan. All right, so here are my references, and I think that's it. Thank you.